Laboratory and clinical medicine specialists in Tehran. The 5th International Congress of Laboratory and Clinic has started in Tehran. Domestic and international doctors and implant surgeons from countries such as the Netherlands, France, Egypt, Turkey, Austria, and the US have attended this event. Iran has over 430 expert medical research centers and is ranked #1 in the Middle East in science, research, and medicine.
The research center is very well equipped, that most of the technology that you need is present. And I was particularly impressed by the level of education of the doctors, nurses, technicians, PhDs.
Scientometry in Iran show that we have the in the ranking of the countries, we are first rank in the Middle East, in compare especially with Turkey.
Experts explain the main purpose of this annual Congress is to help fill the gaps to optimize the ability of practice and clinical trial to effectively utilize laboratory services for patient care.
Through the molecular methods, we get much more insight in the biology of the diseases, and the diagnosis improves, which means we get a diversification of diseases. So for instance, a few years ago we had 10 leukemias. Now we have 30 types of leukemias because we can diagnose them better. We have more treatments, we have new drugs.
The second aim is to bring clinical laboratory integration into Health Collaborative, or CLIHC.
The center is specialized, and there are so many patients. So I was impressed by the number of bone marrow transplants they've done, more than 4,000, which is more than we do in my university. They do 400 transplants per year. It's excellent. It's more than some of the American centers. So it's only Boston and Houston probably get to that level, and maybe Seattle.
Together, these two ideas help maximize patient care.
Well, in the first place, you cannot do clinical patient care without laboratory support. Laboratory support contains, for instance, blood transfusion, contains genotyping, contains molecular investigations of the cells, and that all is important for the prognosis and for the treatment. And so the gap between the laboratory and clinical care is closing more and more and more, and what we call, like bedside research.
Laboratory and clinical medicine help advance patient care and provide better research in areas such as DNA synthesis, DNA extraction, DNA modifying enzymes, cell culturing, and next-generation sequencing, or NGS. According to the Director General for Research of Iran's Health Ministry Office, by 2016, it is projected Iran to be ranked top 10 in the world in science, research, and medicine. The 5th International Laboratory and Clinic Congress will continue until January 18th in Tehran. I'm Intl, Press TV, Tehran.